This week on Malaria Watch TV, we'll take a closer look at the expansion of the Congressional Malaria Caucus to cover neglected tropical diseases.
Together, malaria and the 7 most common neglected tropical diseases cause nearly 2 million deaths each and every year. An African child dies every 30 seconds of malaria. This terrible disease costs more than $12 billion each year in lost productivity and costs many African nations more than 40% of their health care budget. It wreaks havoc, quite frankly, on villages and governments throughout the continent. On the neglected tropical disease front, an estimated 1.4 billion people, that's 1/6 of the world's population, are infected with one or more neglected tropical diseases. In short, malaria and NTDs cause limitless human suffering and devastate developing societies at the very time they're struggling to rise and to get ahead. The second reason is because most, if not all, of the countries that are gripped by malaria are also gripped by neglected tropical diseases. The geographic overlap of malaria and neglected tropical disease facilitates the sharing of healthcare expertise, treatments, and distribution mechanisms. I think sometimes when policymakers back here talk about neglected tropical diseases versus malaria versus HIV, I don't think they quite understand that when someone is afflicted in Africa, they don't look around to find the malaria clinic. They go to the nearest healthcare facility that they can to get treatment.
Africans have pioneered primarily through the River Blindness Program. It's a program called APOC. Is a network of community drug distributors, and this has largely been designed because there was insufficient resources to work through a traditional health systems approach. So the Africans themselves trained the community members how to distribute the drugs, monitor their impact, and make sure that it was having the intended effect both on the epidemiology of the disease and really looking at how communities organize around their own health. And so this network has expanded to now 500,000 community drug distributors in Africa alone. And a study that was done in 2007, it was finished in 2007, it was a multi-country study, over 2 million people, looked at how do traditional health systems work to get drugs to the field, including NTDs and malaria, versus this community network. And the results really were astounding. Through the community approach, they were able to reach all the rollback malaria targets. That means children were diagnosed with malaria and treated in meeting the 50% target. More people were sleeping under nets, that's pregnant women and children, 2-fold more than through the traditional health district mechanism. And all of this was done at no additional cost, so highly efficient. So we hit the targets for malaria, we hit the targets for the NTD drugs, and we did this at no additional cost.
Basically, this expansion of the caucus from malaria to malaria neglected tropical diseases makes sense on 3 levels. It makes sense for the members, it makes sense for the people we serve, and it makes sense for the taxpayers. It makes sense for the members because Mark has supported and the members have gladly signed up because they care deeply about the issues of people in low and middle income countries, out of compassion, out of generosity. And these are people who have long histories of concern for people in Africa, people around the world in less fortunate settings. And they care about more than malaria. Yes, they care about malaria, but they care about people, and they care about people's lives. So it's more than malaria, so it makes sense for the members, because of their deep compassion and their deep concern for more than malaria, to expand to neglected tropical diseases. It makes sense for the people we serve, as has been mentioned, because as we used to say when we were starting a PEPFAR, you have to meet people where they are. And where people are is in their homes and in their communities, and they don't go to a clinic saying, I just have malaria, or I just have neglected tropical disease, or I just have anything. And they're not looking for a physician or a nurse or a practitioner to just provide one service. If you ask people in a clinic or in a community, would they like connected services between malaria and neglected tropical diseases, or would they like to go to separate facilities, they would have a pretty clear answer. And that needs to be our answer and our approach when we design programs. The third point is it makes sense for the American taxpayer. It doesn't just make sense on a common sense level to integrate programs. It makes sense from a dollars and cents perspective. that when you integrate programs, you save money. It makes no sense to develop separate infrastructures. It makes no sense to do separate trainings and logistics systems, and that's precisely what we do in development. So wherever possible to integrate is good for the American taxpayer. And as Mark said, that means it's good for development overall, because wasting money or doing non-integrated systems is not good for development overall. It's not good for support for development, which comes back to the members, which is why we're here. So I think this makes perfect sense on 3 clear levels.
For more on the Congressional Malaria and Neglected Tropical Diseases Caucus, visit our website at malariapolicycenter.org.